struggling with hormones that are out of balance or an adrenal that's not quite operating up to speed and where it needs to be for their level of stress. And a lot of times what happens is women go years and years without getting, number one, lab testing to actually uncover the root cause, but a lot of times get kind of pushed off or dismissed and being told that they have anxiety or they're too stressed or they just need to get some sleep and that would fix all their issues. But when we are underdiagnosing and missing conditions completely because we're not doing the right testing and finding the root cause, that's not a problem for women. That's a problem for our medical system. So typically when it comes to complex hormone imbalance issues like endometriosis or PCOS, it sometimes takes anywhere from 7 to 10 years to get an actual diagnosis because it takes that long sometimes for you to request over and over again some testing to be done or even denying treatment with medications that may not be actually helping your condition because your doctor might be guessing as to what's going on. So women are touted for having a higher pain tolerance, but that's also a significant reason why we're not getting taken seriously in a medical doctor's office, because a lot of times we can downplay our symptoms and even the urgency of our symptoms. And a lot of times we're not taken seriously, or again, we're just brushed off or our concerns are dismissed. Women are on average more likely to suffer from chronic illnesses like chronic fatigue syndrome, fibromyalgia, and even autoimmune disorders, because those conditions have very vague and changing levels of pains, and a lot of times they're not readily visible, and they might not have physical signs that are being observed by your doctor, so your doctor may think that you're over-exaggerating your symptoms, even if they're very real for you. Another thing that's really important to understand is women's heart attack symptoms are very different from men's, and a lot of time what can happen is when women do have heart conditions going on, they're more likely to die from it, and to make matters more complicated, if they're seen by a male provider, their chance of death from a heart attack actually increases by 12%. So if a female is having heart attack symptoms and is seen by a male doctor, they're more likely to die, 12% more likely, because a lot of times the doctors aren't taking their symptoms seriously. Now, another thing that is kind of a big cause for concern for me as well is in most medical research, a lot of times they're not including women in the testing sample. So a lot of times because women's hormones can be complicated and they don't always exactly respond as well as males, sometimes when it comes to medical testing and even medication testing, women just really aren't used in a lot of the samples and a lot of the research that's been done. So in reality, if there's a newer medication on the market, we may know exactly how it reacts and what it does for males, but that may not necessarily be true for females. So we kind of get the short end of the stick with that too, because we are not necessarily getting the right treatment. We're not necessarily being taken seriously. And if we do have a health condition, sometimes the medications we're being prescribed may not work very well for women because our physiology is different. Our hormones are different. Our body reacts differently than a male's would. One thing that I think is really important to understand is that when women's bodies are stressed, whether that is physical stress like not getting enough sleep, not eating regular meals, physically not able to keep up with the day and having a million things going on, or emotional stress from just stressors in your life, or even having like more inflammation stress internally in your body from health conditions, those things actually deplete women's hormones. And where in a male's body, it would actually increase testosterone levels. In a women's body, it steals away our progesterone. And progesterone is used not only in your digestive system, it's used for joint stability. So when we lose progesterone, we're going to have joints that are unstable. We're more likely to get injured. The other thing, too, is when your progesterone is low, if you do get pregnant, you're more likely to have a miscarriage because of progesterone not being able to sustain that pregnancy. Also, when you have low progesterone levels, you're going to have a very heavy menstrual cycle with lots of bleeding, which can eventually lead to anemic conditions because of that hormone imbalance. So when women are stressed and their body is not functioning well and it doesn't have the support that they need, that negatively affects their health. It affects their immune system. It affects their healing. It affects their digestion. It affects their joint stability so much more than a male, where their bodies, they deal with stress, they increase hormones to deal with the situation. It doesn't deplete their hormones. Women are physiologically designed for their bodies to be not stressed constantly, consistently, even though many of us moms try to be supermom. We're doing everything. We're working out, we're taking care of the house and the family and making sure everybody is able to get where they need to and everybody's on task and knows what's going on with the schedule. But in reality, that can be very detrimental to our health. So if you are dealing with some of the issues where you feel like you're not being heard, you're not being seen, nobody's taking you seriously, I would love to sit down with you one-on-one in my office so we can figure out what exactly is going on for you. What are some root causes that maybe haven't been investigated so that we can actually get answers for you, figure out where we need to start and what we need to do to support your body so it can heal itself. I don't want you stuck on medications forever. I want to figure out what's the problem, how do we correct that and work together so that we can get you relief that lasts. So if that sounds like something you're interested in, check out our website, freedompeoria.org, click the book now button to request an appointment, or you can also give our office a call, 309-689-6200.